Welcome, y'all. I'm Ian Sanders with Oasis Financial Services and Healthcare Unlocked. Today, we're going to go over how to explain benefits with the ACA plan, supplement plans, dental and vision to someone that you're talking to on the phone. We're going to use a worksheet. Now, you don't necessarily have to use the worksheet to explain the benefits. We're just using it for practice. But if you do feel that you need to use it for a while, then go ahead, by all means, use it. There's going to be a link to the worksheet in the comment section below, in the description below, excuse me. And you can use that for a while until you feel comfortable. But at some point, this is the way that you're going to want to present to your clients. And we're just going to use a made up example. So it's not anybody's personal information or anything like that. A lot of it is just going to be the default from Health Sherpa. So first, as always, what you'll want to do is like, comment, and subscribe. If you do like the content, it helps us get in front of more people. Makes it, because I really want to just make sure that we're sharing the information with everyone, whether you're with my team, not with my team. The goal here is that everybody gives accurate information to everyone that they speak to, because the last thing that we want to do is put somebody in a position where they don't have the coverage that they need, or they don't understand the benefits that they have, and this will help take care of that. If you do want to talk to me at any given time or want to have a discussion, you can drop a comment, send a message, and I'll be more than happy to respond to those, because I do. But on that note, let's get into it. So what we're looking at here is just the simple benefit explanation form. It's just a Google sheet with things that you can put in here. And so what we're going to look at first is going to be a major medical plan through Health Sherpa. So all I did was just put in a quick zip code. The auto-populated ages for this couple is going to be male, female, and then a 12-year-old girl. They only make $60,000 a year, which makes them eligible for $611 a month in savings. That's the subsidy right here. And then the cost share reduction lets you know that it needs to be a silver plan, like I went over before. So what we'll do is we're just going to click on silver. We're going to look at what plans are there. And in this case, we're not going to really get into too much what the client was looking for. I'm just going to say that this plan for the $24.12 works well for them. Now, what you want to do when you're actually talking to a client is this. You're going to want to ask them, first and foremost, what's going to be more important to you? Is it going to be this deductible? Is it going to be an out-of-pocket maximum paying for those major things? Or are you more concerned about going to the doctor and want to make sure your doctor's copays are low? You can ask them that by also asking, how many times a year do you go to the doctor? Things like that. In this case, what's going to happen is we're just going to say Blue Cross Blue Shield is going to be the best way to go. Again, this is not selling any particular product. It's just how to put things into the form. So what we're looking at here is the plan details, and this is going to be the way that you explain your plan to your client each time, is through here. It's way easier than doing it the other way. And just to give you a quick example of what that looks like, and this is the reason why I say not to do it the other way, is to click on benefits here. And as you can see, there's a lot going on here. It's hard to explain, and if you go through this with a client, it's very likely that they could get confused, so you don't want to click on that. What you'll click on is plan details, and that's going to give you the information that you're looking for. Now, the only time you would really use this too, I just want to bring this up, is going to be if you're going to have a 2 appointment call with this person or visit, meaning that you're not going to just go through all the benefits and go ahead and get them enrolled right then and there. You're going to collect their information, go back, put it in a way where you can explain it clearly, and then come back. So this is going to probably be your first, I don't know, 5 to 10 enrollments. This is the way you may want to do it. If you've done this before and you already know how to explain it, you can skip this part, but it's going to be the basic formula that you're going to want to use when you talk to someone. So in this one, it's going to be Blue Cross Blue Shield. The actual cost of it is $635.12. What type of network is it? It is an HMO. All right, the doctor's visits, co-pays are going to be 40 and 80. And that just means 40 for a primary care, 80 for a specialist. Urgent care is going to be another important one. That's $60. Ambulance is full price. Sometimes those do have co-pays. And I'm putting full price and then 40% just so that I know that after they meet their deductible, they'll pay 40%. Let's just go back up to deductible. Out of pocket maximum is going to be 7,200. And for this one, because it's a family, what I'm doing is I'm putting 5,700 and then 11,400 so that we know that the family deductible will be 11,400. All right, and then we'll jump down to the emergency room. That's going to be full price. The maximum out of pocket is 7,200, 7,200, 14,400. Oh, I put this in the wrong place. And then the hospitalization is going to be full price 40%. And you're just looking here. All right, now looking at the prescriptions, you have 20, 40, full price, and then you have these here. Now with me, I just have the 20 and the 40. But you'll sometimes want to go through the non-preferred and the specialty drugs too if the person takes those or if they're concerned about it. You can also make a side note. At some point, I may include this, but normally what people want to know is what are my generic prescriptions going to cost $20? What are your brand names going to cost $40? And then if you're going through this, I would also just say, well, it's full price for your non-preferred and specialty drugs, which is $80 after you meet your deductible for your non-preferred brand, and then $350 for your specialty. But the main things that people are going to want to know are going to be the $20 and the $40 for the brand and the brand and generics. Now, with the supplemental plan, and I'm not going to get too much into how to pick a supplemental plan right now, but we will get into that in another video. So what we're going to look at here is just going to be with Allstate, and we're going to put the date of birth in. So the date of birth that we're going to use here is 8/05/1989. We're going to use the same zip code. Oh, sorry, that's the effective date. The date of birth is going to be 8/05/1989, and the effective date is going to be tomorrow. And now you don't need to necessarily fill these in. The what you do have to fill in though is the date of birth. All right, and then we'll hit quote. So that got us 35 and 12. None of these used any tobacco products. But what we're looking for here in this particular one, again, we're not getting into the weeds here. I'm just showing you how to use the worksheet. So normally what will happen is, and this is a preference thing, is if somebody has a $5,700 deductible and out of pocket of 7,200, what I'm going to do is, as long as it's within budget, I'm going to try to take care of this with one of the accident and sickness plans. So what I'm going to do is just take a quick look here. I see that the 7,500 will allow me to take care of that. But the thing about this is it doesn't allow you to add the sickness portion on for the 7,500. We'll cover that in another video. I'm not sure exactly why that is. And for an additional $1.73, you can get an extra $400 of coverage. So with this, when I add it, I can now add the sickness and hospital rider. And now what we have here is a well-rounded plan. So we'll jump back into the explanation form. So this is going to be Allstate. The name of the plan is Plan Enhancer. It's an accidental and sickness hospitalization. I'm just going to put hospital. And then the cost of the plan is $75.88. At least right now it is. $75.88. All right, and then it doesn't cover any of these things. So doctor's visits, urgent care ambulance. What you would do is normally put in what it would pay in the event of that. And so what we're going to do is just put hospitalization because that's the only thing that this covers, and it's going to pay 7,900. And then you can add additional supplements if you're doing more than one. Now, this person also wants dental, or we're going to say that they don't want dental and vision in this case, just because it's just getting redundant. So you'll put the company name, the plan costs, what it is for routine cleanings, any major services, minor services, any waiting periods, and you'll explain that to them. The same is going to be the case for vision. The name of the company, the plan costs, eye exams, contacts, how it covers each one of these things, and you'll put that in there as well. So now we'll go through how you're going to explain that to this person. All right. So now what I'm doing is I'm just taking a quick look at this one more time before I get to that. One thing is the cost of the client. We'll want to put that as well. And that's why we look over these things, $24.12. And the name of the plan is going to be this. And some of this you don't have to say, but at least this gives you a good framework of how to explain these things to your clients. So the way that I normally will say this is, let's say I'm talking to the husband. His name is Mr. Smith. Mr. Smith, so I found a great plan for you. It's very comprehensive. It'll cover you if you're in the hospital, cover you're in the doctor's office. It'll also cover you for your prescriptions as well. For your major medical, what we're looking at is Blue Cross Blue Shield. Now, it usually costs $635 a month, but because of the subsidy, the cost to you and your family would only be $24.12. So that's what you would pay each month. It is an HMO plan, which means you do need to stay in network. And the way that it would work is if you went to go see your primary care physician, it would be $40. If you went to see a specialist, it would be $80. Now, if you went to the urgent care, you pay $60. So you'd want to do that instead of going to the emergency room. Because if you were in the emergency room, you'd pay the full price until you hit the deductible. Then after that, you would pay 40%. So with the deductible, the way that that works is it's $5,700 per person. After that, for your hospitalizations and things like that, you're going to pay the full price until you hit 40%. And you're going to pay that 40% until you hit your out of pocket maximum, which would be 7,200 per person or 14,400 per family. At that point, you don't pay anything at all, whether it's prescriptions, doctor visit, hospital stays. You wouldn't pay anything else past that point. For your prescriptions, it would be $20 for a generic prescription, $40 for a brand name. And then with the higher end specialty drugs and non-preferred brand name drugs, what you would end up doing is paying for those at full price until you hit your deductible. And then after that, you would pay the copays for that. Now, the supplement, what we were talking about was the plan enhancer. What it does is it'll pay you a check in the event that you are hospitalized, whether you have an accident or because you're sick. And what this is for is to cover your out-of-pocket maximum. So where we said your out-of-pocket maximum will be 7,200 per person, 14,400 per family. What that means is that if you were in the hospital for any reason, you or any one of your or your wife or your daughter, it would pay 7,900. So you could use that to pay off your out-of-pocket maximum, and then whatever's left over, you'd be able to keep that. And that would be for each individual member of the family. So when you look at your deductible, it'd be $5,700 per person, and then 11,400 for the family. If you ever hit one of those, it would be 40% until you hit the 7,200 or the 14,400. But with this plan enhancer plan, which is $75.88, you wouldn't have to worry about paying anything out of pocket if you went to the hospital because the 7,900 would cover that. Does that make sense? They say yes, you're good to go. If they have questions, then you can jump back and dive into any other questions that they have. Once they do that, of course, the next question would be like, is there anything about this plan that you would like to see, or is anything that it doesn't cover? Or did you have any specific questions about anything? If everything's good, then you'll move on to the application. So this wasn't my smoothest example, but hopefully that'll help you guys see that you don't have to do this perfectly. You can take your time, just make sure that you go over each individual thing. I'll be honest, I haven't used this. I created it a long time ago and I have not used it in a very, very long time. But you can see how easy it is. I didn't even bother really taking a look at it before I started this recording, guys. So look it over, see where everything kind of goes. You can play with it a little bit. What you'll want to do is if you get it from the link in the description section, what you'll do is just go ahead and make a copy of that so that you can play with it and do whatever you want to manipulate it. And this will make it very clear and easy to explain the benefits to your client, because the one thing that you don't ever want is a client that's really confused, because if they're confused, they're just going to have more questions. They're going to start asking other people. They may get bad advice. You don't want any of that to happen. You want to make sure that the families that we're helping are very clear on what their coverages are, and that it's actually meeting the needs that they want covered in the first place, because you should not be offering them things based on your own feelings. It should be largely based off of what they're saying that they want. And then, of course, since you do know this better than them, hopefully you'll also want to act in their best interest. But at the end of the day, they still need to know what you're going to be going over with them. So hope this helped everybody out. Again, if you do like what you saw here, definitely subscribe. There's going to be a lot more videos coming out going over Health Sherpa, how to present. There's going to be information on how health insurance works, how life insurance works. Have a great rest of your day and a great rest of your week. Looking forward to working with each and every one of you. Have a great one.